this is your Houston chiropractor, Dr. Gregory Johnson. We have Marcia here with us today, who God sent her in here to see us, right?
Yes, absolutely.
And she didn't know whether to come at first or not. I'll let her tell her story after we get done adjusting her, but she's had pain in her left thigh down all the way down to her left ankle, pain in her sacroiliac joints in her pelvis, low back pain, mid back pain, neck pain, stiffness, with a headache as well. And all that's doing much better right now. So let's take a look in the mirror. And let's have you flex your head forward and then backwards for me with your eyes closed. There you go. And then neutral. Good. See, we're still evaluating her posture three-dimensionally because that's a mirror of the spinal biomechanics and lets me know how she is progressing from visit to visit. You can tell she sleeps a little bit on her side and rotates because her body's twisted a little bit to the left. That's a positive theta Y. Cervical, thoracic, and lumbar because it's all rotated from the neck all the way down. Okay, very good. So we've got all that down now. So let's do this. Let's go ahead and decompress you first. Now, if you listen really good, you'll hear a ton of Marcia's joints moving. She makes some really good cavitations, which is what you call the little popping noises. That's where the joint opens up, and because synovial fluid has built up gases within the joint, those gases explode, kind of like pulling a dart off the mirror, and it makes a little popping noise. So we got her in there nice and tight. The first couple times we did this on her, she didn't not quite what to think, but then things started getting better. And so we bring the legs up to where they're parallel with the floor. That changes the angle of the pelvis. And we get this wet towel under her skull and her chin. And I've been asked why we wet the towel, so I can get a better grip. Deep breath through your nose. There you go. Perfect. Boy, that was smooth all the way through.
All the way down.
Yep. Every single vertebra from C1 all the way down to L5S1 moves in a straight vertical type of movement when I do that. That is a Palmer diversified cervical master rotary brake, which we did there. Good. And she is still kicking. Good. All right. Always just check the reflexes to make sure that they see that they're still connected and moving good. It's kind of fun too. Okay, Marcia, let's roll over sideways and come over here on your tummy next. I also got a little treat for you today. We're going to show you how we fit a patient with a TENS unit, which is a trans-electrical nerve stimulation unit. We use Preferred Physicians out of Tampa, Florida for that. They make a great product and they stand behind it. We have great patient service. The legs are even, they stay that way, and their pelvis didn't raise up too much. That didn't hurt too much either, did it? But we're still going to adjust her sacroiliac joints. I'm adjusting the right one first. Then the sacrum, straight superior to inferior on the y-axis. And then the left SI joint and left hip joint on the x-axis and the z-axis. We're going to get one more over here on this right one on the x-axis. There we go, good. Now, move right up into L5, right there. L4, L3, L2, all the way up to L1. That's excellent. Now I'm going to put your head down just a little bit to open these joints up. There you go. And just breathe easily and exhale. Okay, nice and easy here. Excellent. Yes, ma'am. Okay, got one more here. There we go. Okay, now, just pretty symmetrical in her muscles. She didn't have any really deep trigger points now, so I'm just going to use the Genie Rub to percuss her tissues surrounding her sacroiliac joints and tensor fasciolata on the sides here. A lot of people call that the IT band. Gluteus medius maximus, piriformis. Left IT band or tensor fasciolata, hamstrings, all the way down into the calves. If she's been having pain from her sacroiliac joints, all the way down to the calves and into the ankles, so we're adjusting those. She's just doing really good. This is only her, what, 6th visit? I have to look at the chart a little closer. I think it's the 6th visit. She's exactly even, she stays even, her pelvis doesn't raise up, so she's got a negative nocklus and a negative Deerfield. And I'm just putting a oblique lateral stretch into the spine by contacting the right SI and then the rib heads here all the way up. Sometimes when we're doing this, you'll hear a really big clunk in the lower lumbar spine or even rib. But she's lined up so well, we're not having any problems with that. Now, I'm going to actually show you how we put the TENS unit on now, which is the transelectrical muscle stem. And again, this is put out by preferred physicians out of Tampa, Florida. And I've got this preset on the frequency and modulation that I want it on, which is continuous for 30 minutes. So I'll just put this up here so we get this out of the way for right now. Now you notice it has a left-hand lead and a right-hand lead. So we're going to put a black pad directly on the paraspinal muscles. The vertebrae you'll feel in the center of the bone. You put this out to the side on the muscles. That's a black lead. Now on the same side, on the left side, you've got a red lead, and you put that directly across from the black lead. Now on this right hand side lead, we're going to do exactly the same thing. We're going to crisscross black, red, but I'm going to put the red lead on her diagonal from the other red lead. So we got red, and now we're going to put black here. So we got red across from black on each one of them, and they are also now diagonal from each other. Okay, so we got those attached. Now if you can just reach up here for me, please, Marshall. And these little knobs right here, if you can just turn those clockwise until you feel them click on. Take them slow though, because it's very powerful. Now turn the other one on where it clicks on. And then you want to turn it up to where you start feeling the electricity. The same on both sides. And I usually do it by feel, not the pad. So you feel the electricity in there now? So now what you want to do is turn it up to your maximum level of tolerance for you, or as much as you can stand for right now. And then just leave it there. Now what this does is it influxes blood and oxygen nutrition into this whole area here, so it promotes healing by improving the blood supply. But what it does also is it fatigues these muscles in the paraspinal area so that they relax, and then that calms down the muscle spasms and muscle hypertonicity. But it also then has a pain reducing effect in that it blocks the pain message that goes up through the lateral spinal thalamic tract of the spinal cord, up into the brain, into the cortex where pain is registered. People say all the time, well, my back hurts or my leg hurts, and I'll say, no, it's in your head, and they think I'm talking about a psychological issue. I'm not. you can only feel pain in your head. In fact, you see a lot of veterans, we do, and they've had their legs blown off or amputated, but they can still feel pain in their feet. That's called phantom pain. Well, their leg's gone, so they're not feeling pain in their lower leg. They're actually feeling that pain in their brain. That's called phantom pain. So, the body is miraculous in how it's put together. Now, let's go ahead and have you sit up, Marcia, and face towards Renee. And I'll just put the other way towards Renee. Yeah, there you go. And you can just clip this onto your pocket or your pants on the side. Yep. And wear it around with you all day long if you want to. And this you can literally wear 24/7 if you want to. So now we're just going to check her shoulders. She's got good, smooth range of motion here. Still get good movement though in the glenohumeral joints. Yep. Good. Okay. Just let this elbow go limp. Good. Relaxing a lot better for those. There. Excellent movement on your wrist. Fingers are still a little stiff. There we go. There. There we go. Good. Marcy, would you mind sharing with our YouTube subscribers and viewers about what your problem was when you first came here, what you'd done about it before you came here, and how you've done with your issues since you came here?
I spent over 2 years in pain and did see an orthopedic and had several epidural shots, and after all of that I was still in pain. After doing my own research online and finding Dr. Johnson's videos and doing some other reading and realizing where the pain was centralized, I came to believe that I had SI joint dysfunction. And since he specializes in this, I just kept praying and praying and praying whether or not what direction to come. Because of my 2 years.
Because you were kind of fearful about it too, because of your family, yes, and your history.
Because of my 2 years, I didn't know where to go, who to see.
Right.
I didn't want to have the same experience.
You don't want to waste more time and money.
Right. So I just decided to take the leap of faith, and came in my first appointment. This is my third week.
8th visit, yep. I just found
my
out.
Third week. I feel completely so much better. I still have some problems when I lay down at night. My husband is amazed.
And he didn't believe in chiropractic at all.
No, he hasn't been, you know.
Very supportive until now.
He just hasn't understood it.
Yeah.
But the gift is that he is gifted, and he has a gift from God.
Thank you.
To touch other people. And
praise the Lord for that every day.
I thank God that I came in. And of course, Renee, you're just adorable.
That's right.
And thank you. Thank God.
Thank you so much, Marcia, for sharing that with you.
Thank you.
And what's your husband's name again?
Rick.
Rick, you watching this? You're going to need to get in here next now. Okay, so let's come over here, Marcia. I'm still got to shoot you. You know I love you. We still got to shoot you.
Okay.
Those pads will stay on there all day long. I mean, everything you do, you can drive and work with them on. You can work out with them on. Okay, let's have you close your eyes and flex your head forward all the way and then backward all the way again. Now see, she's got good full range of motion and no crepitus. She's right down the center now. So the only thing we're going to have her do, her shoulders are rounding a little bit still. So go ahead and open your eyes and let's pull these shoulders up and then back and hold those back like that for me. Palms forward. There you go. That's all right. Now we're just going to bring her straight back in the Z-axis, and then we're going to rotate her straight up on the X-axis, looking at the ceiling. I'm going to hit the atlas on both sides. On the X-axis only. This will send a barrage of neurological information into the cerebellum. You can relax. And let's have you flex forward and backwards again. This should feel even smoother. Yep. How'd that feel to you?
Pretty good.
Great.
Pretty good.
Looks good too. Excellent. So you are never too old or have been through too much to benefit from corrective chiropractic care here at Advanced Chiropractic Relief. And you can go to our website at www.advancedhoustonchiropractor.com. We'd love to see you here. This is your Houston chiropractor. We'll see you next time.